Have you ever felt that frightening sensation that your heart is going to jump out of your chest, beating out of rhythm or too fast, even when you are standing still or resting? For those over 50, feeling the heart miss a beat or suddenly race generates an immediate fear of a heart attack or that something serious is about to happen. This sensation of palpitation is one of the most common complaints in doctors' offices, but we don't always know how to differentiate what is a simple response to stress from what is a warning sign of a serious heart condition. In this video, I will explain simply and directly the difference between tachycardia and arrhythmia, and most importantly, I will give you the exact map of when you can stay calm and when you should run to the emergency room or urgently schedule a cardiologist appointment. Knowing how to interpret these signs can be the difference between preventing a stroke or being caught by surprise. Stay with me, because what I am about to reveal about the silent signs can change the way you take care of your body's engine. Let's start by understanding what is normal and what is not. What is tachycardia and arrhythmia? To begin, we need to demystify the terms. The heart of a resting adult generally beats between 60 and 100 times per minute. When this frequency exceeds 100 beats without you doing physical exercise, we call it tachycardia. It is the racing heart. Arrhythmia, on the other hand, is a broader term that refers to the rhythm of the beat. The heart can beat too fast, too slow, or, what is very common, irregularly and chaotically, as if it were an out-of-tune samba school drumline in your chest. Many people describe arrhythmia as a somersault in the chest, a punch, or a missed beat, as if the heart had stopped for a second and returned forcefully. This happens due to failures in the electrical system that controls the heart. Although it is frightening, not every rhythm alteration indicates a fatal problem, but it is fundamental to know how to distinguish the origin, as the heart ages just like our skin and joints, and the electrical system may need repairs. If you want to have the peace of mind of knowing how to take good care of your heart and receive the best medical guidance for free, check if you have already clicked the like button and if you are subscribed to the channel. This helps our work reach those who need it. Common causes that are not heart disease. The heart doesn't always race because it is diseased. Often it is just reacting to external stimuli that you consume or experience. Excessive caffeine consumption, present in coffee, dark teas, and sodas, is a classic trigger for palpitations, as are alcohol and certain medications for flu or asthma. Additionally, dehydration in the elderly is a frequent and forgotten cause. When water is lacking, the blood becomes thicker, and the heart needs to beat faster to maintain circulation, generating tachycardia. Another crucial factor in this age group is thyroid problems and menopause in women. Hyperthyroidism accelerates metabolism and, consequently, heartbeats, simulating an arrhythmia. Hormonal fluctuations can cause hot flashes followed by palpitations. Therefore, before thinking the worst, it is important to analyze the context. Did you drink too little liquid? Did you overdo the coffee? Are you very stressed? However, there is a very common confusion that leads many people to the hospital unnecessarily, which is our next point. Anxiety or a heart problem? This is the golden question. Is it panic or is it the heart? An anxiety attack releases an adrenaline rush that causes the heart to race violently, causes shortness of breath and trembling, symptoms very similar to heart problems. The main difference is usually the context and the emotional trigger, but physiologically the sensation is very real and distressing. However, true cardiac arrhythmia can happen when you are calm, watching television, or even sleeping, waking you up in the middle of the night. If the tachycardia starts and ends suddenly, as if someone had flicked a switch on and off, this suggests more of an electrical cause in the heart, arrhythmia, than anxiety, which usually has a more gradual onset and end. In any case, you should never assume it's just nervousness without first getting an electrocardiogram to rule out physical problems. The real danger lies in a specific arrhythmia that is often silent and which we will detail now, as it is the leading cause of strokes. The danger of atrial fibrillation, AFib, is the most common type of sustained arrhythmia in people over 60 and requires maximum attention. In AFib, the upper part of the heart does not beat in rhythm. It trembles or fibrillates. This causes the blood not to be pumped correctly, stagnating inside the heart. Stagnant blood clots, and these clots can break loose, travel through the bloodstream, and clog an artery in the brain, causing a severe and often disabling stroke. The big problem with AFib is that it can be treacherous. Some people feel their heart completely out of sync, but others feel absolutely nothing and only find out when they have a stroke. That is why frequent measurement of blood pressure and pulse is so important at this age. If you feel your pulse is irregular, like a clock that doesn't follow the correct tick-tock, this is a red alert to seek immediate medical help to evaluate the need for anticoagulants. This content is vital for your health and that of your family. If you are enjoying the explanations, click subscribe right now and turn on the bell. That way, you don't miss any health alerts that I prepare with such care for you. Leave your like to support the channel. Warning signs. When to run to the hospital now, let's talk about the signs that indicate that tachycardia is not harmless and that you need emergency care. If the racing heart comes accompanied by chest pain, tightness, heaviness, or burning, severe shortness of breath, or cold sweat, do not wait for it to pass. Go to the emergency room. This may indicate that the heart is not managing to pump enough blood to the body or to itself, which can progress to a heart attack. Another critical sign is sudden dizziness or vision fading while the heart is racing. This means that blood pressure has dropped dangerously due to the arrhythmia, and the brain is not receiving oxygen adequately. The arrhythmia, in this case, is causing hemodynamic instability. Ignoring these symptoms, thinking it will pass soon, is a mistake that can be costly. But there is one symptom that is the maximum limit of the alert, which we will see next. Fainting, syncope fainting, which in medicine we call syncope, is the most serious sign that something is wrong with your heart rhythm. If you fainted or had the distinct sensation that you were about to pass out, near fainting, this indicates that the heart stopped or beat so ineffectively for a few seconds that blood flow to the brain was interrupted. In the elderly, this is often confused with age-related weakness or labyrinthitis, vertigo, but it can be a severe heart block. Any loss of consciousness requires rigorous and immediate cardiological investigation. There is no such thing as normal fainting. If there is a history of sudden death in the family, attention must be redoubled. Fainting is the body screaming that the electrical system has momentarily collapsed. The doctor will need to investigate whether you need specific medications or even a pacemaker to ensure the heart maintains the correct rhythm and you don't run risks. How is the diagnosis made? Many people complain that they feel the arrhythmia at home, but when they get to the doctor, it disappears. This is very common, as many arrhythmias are intermittent. Therefore, besides the simple electrocardiogram done during the consultation, the doctor may order a 24-hour Holter monitor, which is a small device you take home that records every beat of your heart for an entire day, increasing the chance of catching the exact moment of the alteration. There are also longer-term tests, such as the loop recorder or stress tests, treadmill test, to see if the arrhythmia appears when the heart is physically stressed. The important thing is not to give up investigating just because the first test was normal. If you feel the symptom, it exists and needs to be documented. Medicine has advanced greatly, and today we have precise diagnoses that guide very effective treatments to restore your quality of life. Do you find this information useful for understanding your body? Then join our health community by clicking the subscribe button. Your presence here is fundamental for me to continue bringing these topics. Leave a thumbs up if you learned something new today. Treatments and solutions. The good news is that the vast majority of arrhythmias have treatment and control, allowing for a long and normal life. Treatment can be simple, such as lifestyle changes, cutting out coffee, reducing stress, treating the thyroid, or the use of antiarrhythmic and beta-blocker medications that calm the heart and regulate the rhythm. For cases where there is a risk of clots, such as an atrial fibrillation, anticoagulants are true lifesavers. In more specific cases, a procedure called ablation may be necessary, which is a cauterization of the electrical foci that cause the arrhythmia, or the implantation of devices like a pacemaker, which takes over command of the rhythm when the heart fails. Do not be afraid of the treatment. Be afraid of the untreated disease. Cardiology technology today is extremely safe and focused on restoring your confidence to do daily activities without fear of your heart failing. Feeling your heart beat is a sign of life, but feeling it beat in a disordered way is a cry for help from your body. If you are over 50, tachycardia and arrhythmia should not be ignored or attributed merely to nervousness without a medical investigation. Learn to listen to your chest. Irregular beats, accompanied by dizziness, shortness of breath, or pain, demand action. Stroke and heart attack prevention begins with attention to the small signs that the body gives every day. Do not put it off. If you identified with the symptoms described, schedule an appointment. Take care of your heart with the same affection that it works for you 24 hours a day without stopping. I hope this video has brought you clarity and peace of mind in dealing with this topic. Your health is your greatest asset. Protect it with knowledge and action. If this video helped you, I ask that you subscribe to the channel and turn on notifications to follow our next health content. Share this video with your friends and family on WhatsApp, as this information can save a life. A big hug, take care of your heart, and see you in the next video.